it's out there, and
Yeah.
I think it deserves a much closer look than it's kind of getting. Medical marijuana, so what do you think?
Hey guys, it's Deon with Green Lady, and today I'm here with my friend Dr. Devin Sperra. So what I've always done personally, if I were to recommend anything for somebody who's just getting into it or has very little experience with it, is I've recommended that first they start slow, really slow, and giving the product time to sink in and pay really close attention to the test results, and even keep their own journal. Would you have anything to add to that? Because there's really not a lot of resources available to people on how to, educate themselves and where to start.
Well, unfortunately, I can tell you that there is next to no resources in the professional medical community for that. Mm-hmm. There's education, and we learned very briefly during medical school about our own cannabinoid system. We have our own endocannabinoid system, and anandamide is, and I'm sure I mispronounced that, is the bliss molecule that we have already in us. This is an endogenous cannabinoid. Mm-hmm. We can potentiate it with exercise and positive things. It's the bliss molecule. But it stimulates CBD receptors, CBD1 and 2, that we have in our body. Mm-hmm. And so then you have this plant, marijuana, that has CBD and THC. THC binds the anandamide receptors. CBD and THC will also bind the CBD1 and CB2 receptors, which are everywhere in our body. Mm-hmm. So it's there within us, and it helps keep us happy, it helps keep us healthy. And to use the medication appropriately, that's the great Wild West at this point. We have no answers as to how much and why and when and where to use it. And so starting low and slow is great advice. Mm-hmm. In my field, I can't give that advice, right, simply because it could have negative effects for those people. Right. It's important to know that CBD use and heavy marijuana use, like I said, can result in bad things. Mm-hmm. One of the things that CBD does, which is a positive and a negative, is it will block the cytochrome P450 system, which is a system within us that we use to metabolize drugs. And they have found, the American Cancer Association, there's been studies that have shown that people, and actually the Neurologic Association, show that people who take medicines for their seizures, for instance, if they take CBD, they find that they need less of the seizure medications because it's not being metabolized as quickly, and you can build it up with lesser amounts, which is great because so much of pill medicine has negative effects, and so always use the least effective amount. Right.
That's awesome. Yeah. What other positive things have you seen therapeutically? Like what's the most common use of CBDs therapeutically in a positive aspect that you see?
Well, that's the problem, is that in my line of work in the emergency department, I'm not getting anybody who is having an issue that I can treat directly with CBDs. Right. It comes about anecdotally. The biggest one, and we've seen it also in Colorado, is that people who have opiate addictions, generally the pills, find that they are using less when they use more marijuana. But that's not across the board. If you have an addictive personality, it is not going to stop you from wanting. Right. However, if you came about your addiction in a way that you have a disc herniation, you were in a car accident, now your doctor is cutting you off of those pills, the want is there, and it came about honestly because you had a real injury. And with the desire to come off of it and the use of marijuana, people are finding that they are using less opiates. Studies in Washington and Colorado have shown a decrease in overall use and overdose. And that in and of itself is fantastic, right, and bears a closer look.
Right.